Hello everyone, welcome to Part 6 US Residency Training and Beyond. I'm Dr. Viswanath, Aluru, attending physician in physical medicine and rehabilitation at Oxford Health in New Orleans. In this video, we will continue with our previous topic, EMR documentation. So what I wanted to mention was that there are mainly few templates that you need in order for you to perform your documentation properly and thoroughly. The first one I want to describe is a consult note template. As I informed to you, so it's very important for you to sit with an IT specialist and then save those templates under your login information, so whenever you open your account you don't have to search for the data to put in your templates, because with the kind of EMR systems that we are using right now here in the US, so it's very easy to get the information that you need to put in your documents, so you don't have to manually enter like wasting significant amount of time. That's why it's important for you to be smart, to be thorough, at the same time to be quick, to be able to document everything that you have to on a day-to-day basis. So the consult note, it's something that you put in when, say, someone consults you for a specific reason. So the patient is already in the hospital, admitted under a different department, and they consulted you for some reason, say for example weakness, right? So in that situation you go see the patient, and then your note will mainly focus on that particular reason why they consulted you. But say if the patient got admitted for, say, new onset atrial fibrillation or uncontrolled atrial fibrillation, then the reason why they consulted you weakness might be related to the existing diagnosis or admission. So in that situation you have to take into context what was the reason for this new onset weakness, and you have to document your recommendations, and then also in relation to the existing condition or admission diagnosis. But in addition to your assessment and plan, of course you have to include your history of present illness, chief complaint, past medical history, past surgical history, social history, civil habits, current medications, review of systems, physical exam, any labs, imaging, any other workup that has already been done, all those things. Okay, but when it comes to an admission note, say for example if you're a rehab resident and the other department, they contacted you for the same patient. Now they think that the patient can no longer go home because of this new onset weakness, so they think that he might need some inpatient rehab therapy. So then they consulted you because you're a rehab resident, so you go see the patient. Now you think that he's a good candidate for acute intensive inpatient rehab, so now you decided to admit this patient. So when you're actually admitting a patient that you saw for a consult, now you have to put in a consult note first and let the department know what you think about this patient. Now if you're admitting the patient, then you have to put in a admission note. So admission note is actually very thorough and elaborate compared to a consult note, because you have to go over all the medications with the patient or family. You have to go over all the pre-existing conditions, all the diagnosis, and then you have to review all the past medical history, past surgical history, allergies, any lab work or any imaging that has been done so far, all those things. And then you have to write your thorough assessment and plan, which includes your plan should include the primary reason for the admission and any pertaining impairments or diagnosis that you want to put in under the primary diagnosis, and then what things that you are monitoring on a day-to-day basis, and then any secondary diagnosis or other comorbidities like hypertension, hyperlipidemia, diabetes, CAD, CKD, all those things. And then because I mentioned that it's a rehab case, then you have to include your rehab plan of care also, which will be based on your thorough physical examination and your evaluation for the patient of the impairments. That's how you document your assessment and plan in the admission note. And it's also very important that if the patient is on several medications from home that you are actually looking at, you have to make sure that each medication, there's a reason why the patient is on medication. If he doesn't know why the patient is on a medication, then you need to discuss with the patient or the family and then assign a etiological diagnosis for that treatment, because you have to put in the treatment plan why the patient is getting this medication, what is the purpose, what's underlying diagnosis. Because there are certain codes, they are called ICD-10 codes. You have to assign an appropriate ICD-10 code for each etiological diagnosis, and then you have to mention what is the plan. Because if the patient is getting several medications and you don't know why the patient is on those medications, you did not document those medications, then it's a problem. If you think the patient no longer needs that medication, then you should discuss with the patient and the family, and then either stop the medication or they wean the patient off that medication completely, and document that in your admission note. That's why it's very important in the admission note you have to include all the reasons why the patient is here, and what treatments are you giving the patient, and what are you monitoring like on a daily basis, on what medications the patient is getting, what are the etiological diagnoses for those medications, all those things. That's regarding your admission note. Then when you start seeing the patient on a daily basis to see how things are going, any changes in the vitals or labs, any changes in the management of the patient, then you have to document the progress note every day, just to document any of those changes. See, if the patient stayed on the unit for like say 7 days, and now the patient is ready to get discharged, now you have to document a visit summary that you will hand over to the patient on the day of the discharge. The visit summary will have all the important instructions that the patient need to follow when the patient goes home, and it also has important information about the medication. So you're going to do just like you did in admission medication reconciliation, you have to do a discharge medication reconciliation. What medications are you continuing? What medications are you discontinuing? What are the changes in the dosing of any medications? So all your visit summary should have all that information regarding medications. And also the visit summary should include any follow-up appointments. If you think the patient should follow up with neurology or primary care or cardiology or any surgery, all that information must be included in the visit summary. So that is the document that you print, or the nurses will print and go over with the patient on the day of the discharge. But once the patient is discharged, then you have to put in a discharge summary in the chart, in the patient electronic medical record. That discharge summary must include like an entire summary for the 1 week, the whole number of days that the patient was on the unit, and it also include day-to-day changes like interval history. It also includes like a problem-based like management of each of those diagnoses, primary or secondary diagnosis, and the vitals and labs on the day of the discharge, physical examination on the day of the discharge, and the functional status. If there is a rehab residency program, we have to include the final discharge functioning status, and any medications, diet orders, any other orders, including follow-up appointments. That's how you write your discharge summary. So that's why it's very important to go over all the medications, go over all the diagnoses with the patient, and assign appropriate ICD-10 codes. And also, whenever you sign your document, you should assign an appropriate billing code depending on whether it is an inpatient location, or whether it is an outpatient location, or whether it is like a consult document that you are typing. And then depending on how much time you are spending in each of those situations, you have to pick appropriate billing code and then assign that code. So when this notes is evaluated by the billing team, they will bill appropriately for that service you have rendered to the patient. So these are the main different note types. And then there will be, if you're like a surgery resident, you have to put in like a pre-op notes, and then you have to put in a immediate post-op notes. And then any bedside procedures you have done, you have to do a procedure note. For procedures, there are some other billing codes. The codes are very different, so you have to include appropriate billing and ICD-10 codes for any procedures. Same thing with the outpatient setting. When you see the patient for the first time in the clinic, you have to write an elaborate note, and then there will be a follow-up note, which is not so elaborate. Okay, you're just checking the patient to see how things are going in a follow-up visit, and then you bill appropriately. And then there will be procedures you can be bill like during the outpatient visit. So these are the different types of outpatient notes that you can write. With this, I am going to end this topic, which is your EMR documentation. And in the next video, we're going to discuss about patient care. Okay, thank you for watching this video. I will see you all in another video. Good day.